I'm a receptionist at a walk-in clinic in Oslo. This American woman comes through the door holding her wrist at an odd angle. She'd slipped on ice outside our building, and the pain had her sweating. I asked for her insurance card, and she dumps her entire purse onto the counter, pulling out 3 different cards, 2 crumpled receipts, and what looked like a small novel of paperwork. She kept saying she needed to call someone first to get pre-authorization before we could even look at her wrist. I told her we don't do that here. We just treat people. She stared at me like I'd told her gravity worked backwards in Norway. When I explained she'd only pay a small fee, maybe 200 krona, she asked which payment plan that was and whether she needed to refinance her mortgage first. The wrist was fractured. We casted it. She paid about $18. She stood in our lobby for 10 minutes convinced we'd bill her $8,000 later. She called our clinic 4 times that week checking if the real bill had been processed yet. My cousin runs a pharmacy in Lisbon, and he told me about this American tourist who came in with a prescription from her doctor back home. She'd been managing a chronic condition and needed a refill for her medication. He filled it, handed it over, and told her it was €4. She asked if that was the copay. He said no, that's the full price. She stood there doing mental math out loud, trying to convert euros to dollars. Repeating that back home, this exact medication costs her $340 per month, even with insurance. When he confirmed the price was correct, she bought 6 months' worth on the spot and asked if she could legally mail it to her friends back in Boston. He had to explain that while technically legal, customs might have questions about a suitcase full of prescription bottles. I work at a dental clinic in Budapest, and we get a lot of international patients because our prices are lower than Western Europe. This American guy scheduled a root canal, and when we quoted him the price, he asked if we were running some kind of charity operation. The procedure would cost him about $120. And he'd calculated that back in Denver, the same work would run him nearly $1,800 after insurance. He kept asking what the catch was, whether we used proper anesthesia, if our equipment was certified, whether the dentist had actually gone to dental school. I showed him our JCI accreditation certificate, and he said he'd never heard of that, so it must be fake. The dentist had trained in Switzerland and spoke 4 languages. After the procedure went perfectly, the American told us we should move our practice to the United States, where we could charge real prices and get rich. He couldn't comprehend that our dentist was perfectly happy earning a middle-class salary while not bankrupting patients. My sister manages a small hotel in Reykjavik, and this American couple checked in for a week-long vacation. On their second day, the wife slipped in the shower and possibly broke her ankle. They asked my sister which hospital accepted their insurance. And when she said all hospitals here are public, the husband asked what people without insurance do. She explained Iceland has universal coverage, and they both went silent. The husband asked if that meant they'd have to pay cash up front, maybe $20,000 or $30,000, and my sister just laughed. She called them an ambulance. They spent 4 hours at the hospital, got x-rays, a cast, crutches, and paid about $40 total. They kept asking when the itemized bill would arrive at their home address in Michigan. My sister had to explain 3 separate times that no additional bill was coming. They didn't believe her until they flew home 2 weeks later and nothing ever arrived in the mail. The wife called the hotel 6 months later just to confirm they hadn't somehow missed a bill. I'm a program coordinator at a university in Stockholm, and we host a lot of American exchange students. This one student showed up at my office in tears because she'd been to the student health center and they'd refused to tell her the cost for treating her strep throat. She kept repeating that she needed to know the price so she could decide if she could afford it. Maybe just buy antibiotics over the counter instead, or wait until she got home. I explained that student health care is included in her semester fees, but she insisted there had to be a separate charge. She'd grown up comparing urgent care prices online before deciding whether to seek treatment, and the idea that she could just show up and be treated without discussing payment first seemed impossible to her. When I showed her the fee structure showing she'd already paid for unlimited visits, she said this seemed like a scam because nothing medical is free. She went back to Texas, still convinced Sweden would eventually send her a bill for thousands of dollars. My brother works dispatch for emergency services in Dublin, and he took a call from a panicked American tourist whose travel companion was having chest pains, standard heart attack symptoms, Very serious situation. But this American spent 3 minutes of the call asking about costs, whether they should call a taxi instead to save money, if they could go to a cheaper hospital, whether the ambulance charged by the mile. My brother kept trying to explain that an ambulance is a medical emergency service, not a taxi with a meter running. The American finally said his friend didn't have travel insurance and couldn't afford an ambulance. My brother told him Irish emergency services don't check insurance cards before responding to heart attacks. They sent the ambulance, treated the patient, and the total bill came to about €100 for the non-resident. The American called back later to report a billing error because he'd budgeted for at least $15,000 based on what an ambulance costs in Arizona. My brother had to assure him multiple times that €100 was the correct and final price, not a deposit. I'm a translator at a hospital in Copenhagen, and I once worked with an American family whose daughter had broken her leg while they were touring the city. Standard fracture, needed surgery to set it properly. Before we could even start discussing the procedure, father pulled me aside and asked how much the surgery would cost because he needed to call his bank about a loan. I told him to focus on his daughter and we'd handle billing later. But he insisted he needed to know if they were looking at $30,000 or $50,000. When I estimated maybe 3,000 kroner, about $425, he accused me of lying to get him to agree to the procedure. He said he worked in hospital administration back in North Carolina and knew exactly what orthopedic surgery costs. I had to get the billing department to come explain in writing that the estimate was accurate. After the surgery, the final bill was actually 2,800 kroner. The father spent an hour arguing with the billing office that we'd obviously left off several pages. He demanded an itemized breakdown showing the surgeon's fee, the anesthesiologist's fee, the facility fee, the equipment fees. We don't bill that way. But he was convinced we were running some kind of illegal operation. My aunt works the front desk at a health clinic in Rotterdam. And this American came in for a routine checkup because he'd be living in the Netherlands for 6 months on a work assignment. When she asked for his health insurance card, he produced a leather folder with about 9 different cards, a laminated explanation sheet, and a phone number to call for pre-authorization. She told him he just needed his Dutch residence permit, and he asked which insurance company that was with. She explained the Dutch system is public, but supplemented by private insurance. And everyone is required to have coverage, and his employer had automatically enrolled him. He asked what his deductible was, and when she said, probably around €385 annually, he stopped breathing for a second. Back in Texas, his deductible was $6,000 per person. He asked if the €385 was monthly, and when she confirmed it was yearly. He asked to see the clinic's medical director because this sounded fraudulent. My aunt had to walk him through how the Dutch system works 3 separate times before he'd believe that a real, functioning healthcare system could cost so little out of pocket. I work at a pharmacy in Warsaw, and this American woman came in with a prescription for insulin. She asked the price, and I told her about 35 xvoti, roughly $8. She stared at the insulin pen in my hand, looked at the price, looked back at the pen, and asked if it was expired or counterfeit. She told me that back in Indiana she pays $320 per pen, even with insurance, and she needs 4 pens per month. When I confirmed the price was correct for a brand name pen, she started crying right there at the counter. She bought 3 months' worth immediately and asked if there were legal limits on how much she could take back on the plane. I explained Polish regulations allow a 90-day supply for personal use, and she spent 20 minutes on her phone texting photos of the receipt to people back home. She told me her sister had been rationing insulin for 2 years to save money, and this price seemed criminal. She kept saying it was impossible that real insulin could cost so little. My father manages a radiology clinic in Tallinn. An American patient came in needing an MRI for persistent back pain. The scan cost about €80, and when my father quoted the price, the American asked if that was just the consultation fee before the actual scan. He explained, no, that's the full price for the MRI, with the radiologist's report included. The patient asked whether they'd be using a refurbished machine from the 1990s to justify the low cost. The equipment was a Siemens Magnetum from 2018, newer than most American hospitals. After the scan, the American sat in the waiting room, calculating costs on his phone and muttering about how his back pain had cost him $2,400 in the United States for the exact same procedure, and his insurance had covered only $600 of it. He asked my father if he'd ever considered opening a medical tourism business specifically for Mr. Is. My father politely explained he was happy serving the local community at accessible prices. I'm a nurse at a maternity ward in Ljubljana, and we had an American couple who'd moved to Slovenia for work just before discovering they were pregnant. When they came in for their first prenatal visit, they brought a 3-ring binder of insurance documents and asked which forms we needed to process their claim. I told them to just bring their insurance card for the next visit, but they insisted on understanding the full cost structure up front. Back in Ohio, they'd been quoted $12,000 for uncomplicated delivery they'd been saving for 2 years. When I explained their entire pregnancy care, delivery, and postnatal care would cost them maybe €100 in copays, the wife started laughing in that slightly hysterical way that means someone is about to cry. She said they'd been planning to fly back to the United States for the birth, because they assumed no other country could provide adequate maternity care. The husband asked if the low price meant Slovenian doctors were less qualified, and I showed him our maternal mortality statistics, which are significantly better than America's. They ended up having their baby in Ljubljana and sent us a thank you card with a photo, noting they'd saved enough money to buy a car with. What they hadn't spent on delivery costs? My uncle works at an optometry clinic in Prague, and this American tourist came in with broken glasses, desperate for a replacement pair. He got an eye exam, ordered new frames and lenses, and when we told him it would be about 2,500 Czech koruna, around $110, he asked what the insurance portion was. We explained that was the full price without insurance. He said that back in Seattle, his last pair of glasses cost $580 after insurance covered part of it, and we were offering the same service for 1/5 of the price. He accused us of selling Chinese knockoffs, until my uncle showed him the frames were from the same Italian manufacturer he'd bought in Seattle. He ordered 3 pairs of glasses on the spot and told us we were sitting on a gold mine if we'd just charge American prices. My uncle told him Czech people couldn't afford American prices. The American said that was exactly why universal health care doesn't work. He said competition drives innovation, and low prices mean low quality, ignoring the fact that he was about to walk out with 3 pairs of high-quality Italian glasses for less than he'd paid for 1 pair back home. I'm a medical records clerk at a public hospital in Brussels, and this American patient needed copies of her records to take back to her doctor in Boston. Standard request takes about 15 minutes to process. I told her there'd be a small administrative fee, about €5, and she asked if that was per page. When I said no, that's the total cost for the complete file, she accused me of misunderstanding her request. She wanted her entire hospital stay records from a 3-day admission, including blood work, imaging, medication logs, everything. I confirmed that €5 covered everything, and she asked if Belgium used some kind of different page counting system. She explained that her last medical records request in the United States had cost her $146 for 23 pages. When I handed her a 47-page file for €5, she asked to speak to a supervisor because this billing made no sense. My supervisor explained that in Belgium, medical records are considered the patient's property, and we can't charge excessive fees for something that belongs to them. The Americans said that sounded socialist and would never work in a capitalist system. My supervisor didn't bother explaining that. Belgium is also a capitalist system. My sister works at a hospital billing office in Vienna, and an American patient came in to settle his bill after a 4-day hospital stay for pneumonia. The treatment included for antibiotics, breathing treatments, monitoring, and a private room. The bill came to about €900, and when my sister showed it to him, he asked where the rest was. He'd been admitted through emergency, stayed for nights, seen multiple specialists, had chest x-rays and blood work, and received round-the-clock nursing care. In his experience from Texas, a hospital stay like that would generate a bill somewhere between $40,000 and $65,000. He insisted there must be a second bill for the emergency room, another for the imaging department, another for the specialists, and probably another for the pharmacy. My sister explained Austrian hospitals don't fragment billing like that, and his insurance had already covered most of it anyway. The 900 euros was his total out-of-pocket cost. He asked if Austria was in a recession or something, because these prices suggested a collapsed healthcare market. My sister told him Austria consistently ranks in the top 10 healthcare systems globally. He said that couldn't be true, because if it was, Americans would know about it. I'm a paramedic in Helsinki, and we responded to a call about an American tourist who'd collapsed on the street, likely from dehydration and low blood sugar. Simple case. We checked vitals, gave him some water and a glucose tablet, monitored him for 20 minutes, and determined he didn't need hospital transport. As we were packing up, he asked how much he owed us. I told him there was no charge for the assessment since we didn't transport him. He pulled out his wallet anyway and insisted on paying something because back in Colorado, an ambulance call-out costs $1,200 just for showing up, plus $25 per mile if they transport you. When I confirmed there was genuinely no charge, he said he didn't understand how paramedics get paid if they don't charge patients. I explained we're salaried government employees, like firefighters, and emergency medical services are funded through taxes. He said that sounded inefficient and socialist, and Finland must have terrible emergency response times as a result. I told him our average response time in Helsinki is about 6 minutes. He said American systems must be faster because they charge more, and he seemed shocked when I pointed out that higher prices don't automatically mean better service. My cousin works at a dental surgery in Krakow, and this American student who'd been studying in Poland for a semester needed an emergency root canal. His tooth had been bothering him for weeks, but he'd been avoiding treatment because he assumed it would cost thousands of dollars he didn't have. When the pain became unbearable, he finally came in, and we quoted him 450 zloty, about $110. He asked if that was the consultation fee, and we explained that was the complete cost for the root canal, including anesthesia and follow-up. He started laughing and said he'd been rationing pain medication for 3 weeks over a bill that cost less than his textbooks. After the procedure, he told my cousin that American dental students learn that root canals cost $1,500 to $2,000. So charging $110 meant polished dentists were either incompetent or the equipment was outdated. My cousin showed him the clinic's modern equipment and his credentials from Medical University of Warsaw. The American apologized, but then said he still didn't understand how dentists make a living on such low fees. My cousin explained that when you're not trying to cover malpractice insurance that costs $50,000 annually and pay off $400,000 in student loans, you can charge reasonable prices and still make a comfortable middle-class living. The American had no response to that. I work at a small urgent care clinic in Bergen, and this American hiker came in with a nasty gash on his leg from slipping on a rock during a trail hike. Needed about 8 stitches, plus a tetanus shot, and antibiotics to prevent infection. Standard procedure took maybe 40 minutes total. When he asked about the bill, I told him it would be around 300 kroner, about $27. He asked if that was the copay before insurance, and I explained that as a tourist, he'd be paying the non-resident rate, which was about 1,200 kroner, around $110 total. He started laughing in a slightly unhinged way and pulled up his phone to show me a medical bill from Arizona where an emergency room visit for stitches had cost him $3,800. He kept saying it was impossible that Norway could provide the same care for 97% less money. I told him we just don't have the same overhead costs and administrative complexity as the American system. He said American healthcare was expensive because it was the best in the world, and Norwegian healthcare must be substandard to cost so little. I pointed out that Norway's life expectancy is for years longer than America's, and we have lower infant mortality rates. He said those statistics were probably manipulated because socialism requires propaganda. My father works as a health policy analyst at the Ministry of Health in Bratislava, and he was part of a delegation that visited the United States to study their healthcare system a few years ago. They met with hospital administrators, insurance executives, and government health officials to understand how the American system worked. One hospital administrator explained that they employed more billing specialists than nurses, and my father thought he'd misheard. The administrator confirmed that half their staff existed solely to process insurance claims, fight denials, and pursue payments from patients who couldn't afford their bills. A family practice doctor told the delegation that she spends about 40% of her time on paperwork related to insurance rather than actually treating patients.